Okay, Megan, I'm going to put you through a series of 3 standardized field sobriety tests, okay? They're promulgated and made up by the National Highway Traffic Safety Administration. The first one is called a Horizontal Gaze Nystagmus Test, or it's sometimes referred to as HGN, okay? Can you see the tip of this pencil, the eraser?
Yes.
Okay, what color is it?
Red.
Okay, go ahead and take your right hand for me and reach out and touch the tip of that eraser. I just want to make sure you know where it is, okay? In a minute, I'm going to move this tip of this eraser from side to side. It's very important that you follow with your eyes and your eyes only, and do not move your head. I want you to keep your head perfect where it is, looking straight ahead. Do you understand?
Yes.
Okay, here we go.
The HGN test was hard for me because it lasted for so long that I felt myself getting anxious and my eyes were strained and I was thinking, can I blink? Oh no, I better follow this pen and not screw anything up.
Okay, I want you to follow it all the way out. Other eye. Other eye.
The HGN test was physically difficult about halfway through when I felt myself start to get really anxious and my eyes were straining, and looking all the way over to the side was hard, and it was hard to hold my eyes over there for a long time.
Okay, I'm going to move slowly to your left, okay, very slowly.
Coming into today, I didn't know what to expect as far as the specific tests, but I knew that I was going to be walked through a series of sobriety tests, but I didn't necessarily know exactly what I was going to be doing. Yes, what you see on video is me 100% sober.
Okay, Megan, I'm going to go straight up, okay? Follow it straight up. One more time. That test that I gave to her, that was probably in the 3.5 minute range, 3 minutes, 3.5 minutes. That's a long time to focus on something. And yes, there were a couple of times when I could tell she was getting a little anxious, and she would actually look ahead of the stimulus. So she would look towards it and then look back. I knew that what I was seeing, the jerking I was seeing, was not because of alcohol, it was because she was anticipating the movement of the stimulus. But yeah, I could tell that she was straining some. And it's not an easy test to do. The longer we went on, she anticipated the movement. And she was darting her eyes some. But as far as the whole test goes, I think when Megan became the most nervous was after the test, when I told you what I was looking for and how easy it was to get what I'll call a false positive, which when I did on Corey's eyes. I think that's when you started getting nervous, because really, they got you on this test. I mean, I don't think there's any way around it. If you misadminister this test, you can make the eyes jerk. We saw that out there. So I think her anxiety level grew even after the test was administered. A false positive, using the HGN test as an example, the officers are looking for jerking of the eye. The human eye can track a moving object so many degrees per second. The literature that I've seen is roughly between 20 to 25 degrees per second. That's why on the HGN test they have timing protocols. 2 seconds out, 2 seconds back, things of that nature. You want the eye to be able to lock on the target and follow it all the way. If you speed up the movement of the target, you'll still see the eyes jerk. However, you have a positive jerk, but the reason that you think it is false. It's not the alcohol that's causing it to jerk, it's human error. And that is the biggest problem that I see. I've been evaluating these tests for 17 years, and officer error is the biggest problem.
So I know one of the things that I often get asked by friends, by colleagues, by potential clients is, should I have taken the field sobriety test? Should I have submitted? Should I have complied with an officer's directives or an officer's commands? And in Los Angeles County, I think 99 out of 100 times, if they have asked you to get out of the vehicle and they've asked you to perform any of these tests, at some point during that investigation, you're going to be arrested.
So I think many times people think, and even jurors, if they don't do those, that means that they're trying to hide something. That means they're intoxicated. To me, it means, look, I don't have to prove anything to you.